What would you do if a relative was critically ill with a genetic illness?
Would you get genetic testing and take dramatic steps to prevent getting that same illness? Tonight, medical reporter Meg Ferris takes us on the emotional journey of identical twins who are faced with that decision.
Growing up in Ocean Springs, they were known as the Roberts twins. Now 36, identical twins Erica Schrock and Nicole Walton are still best friends.
Erica and I have always had a close relationship where we talk almost daily.
But it was impossible to know then that this year they would share devastating health news, a courageous decision, and together move forward with a brave solution. It started when big sister McCall, also only in her 30s, got devastating news: advanced breast cancer that had spread to her bones. Her genetic test showed why: a mutation in the BRCA1 gene inherited from her father's side. Nicole, a doctor of osteopathic medicine, went to McCall's biopsy.
That's the first time I think I actually saw her skin and breast tissue, or saw her breast, and I knew at that moment that's likely what this was.
The twins, always in perfect health, now knew they needed the genetic test. The doctor reached Nicole by phone first with her test results.
I mean, I was in a state of disbelief because I honestly didn't believe I was going to have this. But I actually called Nicole because I had missed a call from him. So I called Nicole and she already knew the news, so she told me.
Positive for the same mutation as their big sister meant an 80% risk of getting breast cancer. The twins, each married and each with 2 young children, had a decision to make.
It seems like a dramatic decision, you know, but when you see the numbers and you see your sister, it's no question. I mean, it's like this is what needs to happen.
Being alive for Nicole's 2 little girls and Erica's 2 little boys was all it took for the twins to know in their hearts they would both get double mastectomies. The surgery to remove their healthy breasts would bring them down to a less than 1% lifetime risk of ever getting breast cancer. The two, as always, would take the step together.
Having each other, that we both have it, has helped us, I think, be stronger to move forward and take these steps that are very difficult, but we feel like are necessary.
The twins researched their options of multiple surgeries, skin expanders, lengthy recoveries, and losing all their breast skin and nipples. Then a doctor insisted they go to the Center for Restorative Breast Surgery in New Orleans.
When we left, we all left and said, wow, we feel so much better about this whole process. We feel more confident now in what we're doing, and we feel good about this.
It's bad news to hear that you have a risk of developing a malignancy over the course of your lifetime, but the good news is that you can do something about it.
The twins learned that surgeons there could still reduce their risk while never altering the outside of their bodies. From her hospital bed, Sister McCall, who was marching through chemo, major surgery, radiation, as the breast cancer now spread to her brain, cheered her little sisters on.
She knew that we were there for her, and then, you know, she said, I want y'all to go do this. Don't even think about not doing it.
The twins had their surgery back to back. Doctors made a small incision in the fold and scooped out the internal breast tissue of fat and glands. Then they put cohesive implants in its place, the kind that can't spill or leak. Then they closed the incision, leaving only a small hidden scar. The breast skin, nipple, and areola remain completely their own and intact. Cancer risk is still reduced by the same as the other radical surgeries. It's the same surgery, reportedly, that actress Angelina Jolie had when she faced the same genetic results. At the first post-op visit, with drains still in place, the twins, who have no secrets, wanted to be examined in the same room to compare results.
It's unbelievable to me that, you know, Dr. Ordone was able to do a total mastectomy out of an incision this big. That's unbelievable.
Weeks later, as the swelling continues to go down, they look more natural and know they made the right decision for their families. They are awaiting the genetic results of another little sister, Megan.
I mean, I pray to God that she doesn't have the gene, but if she does, then of course we'll be, you know, right there.
And they know big sister McCall's pain is saving their lives.
Do you also feel very guilty that you have your sister who didn't have that option?
The twins will have their children genetically tested soon, so at a young age, they can begin to openly talk about their futures and options. And because so many people think a decision like this is so radical and are unaware of this potentially life-saving option that is both cosmetically pleasing and fast healing, they have a new mission.
We can't understand why this is happening to us and our family, you know, but we believe, you know, that God has a plan for us. And I believe that this interview and getting this information is going to help somebody. And I think God had a hand in that.
And they ask for His hand in McCall's life.
And we do pray that for a miracle for her, that she will live to see her son
Even just to see
grow up.
And now, something unusual has just happened to McCall. 8 weeks ago, doctors told her that the multiple cancer lesions throughout her brain that they were treating with radiation were incurable. But last week, a scan showed they had all disappeared. The family says her doctors are baffled by the unexpected change. She's continuing her chemo.